The time is 10 o'clock. Here is Eye Health News at 10. First, the headlines. Ophthalmologist urges people over 50 to prioritize eye health to prevent blindness. Centenarian grandmother in Ogun State shares ordeal as daughter battles blindness due to cataracts. On the foreign scene, NHS unveils groundbreaking eye cancer treatment, offering hope to uveal melanoma sufferers. Rwanda's blindness eye virus outbreak, a growing threat with global implication. New eye clinic in Bunbury tackles Aboriginal eye health with culturally safe preventive care. Now the news in details. Dr. Oladak Bawoden, a consultant ophthalmologist in Abeokuta, has advised individuals aged 50 and above worldwide to take their eye health seriously to prevent blindness and maintain independence as they grow. Speaking on RLTV program, Optical Perspective, Dr. Awoden, who retired from the eye department of the Federal Medical Center in Abeokuta, emphasized that cataracts are a very common condition affecting many older adults, though not all, and can lead to blindness if untreated. He explained that cataracts are not unique to Africa, but it's a global issue affecting all races. According to Dr. Awoden, about 2 billion people worldwide suffer from eye-related issues, with approximately 90 million cases of blindness caused by cataracts, accounting for nearly 48% of global blindness cases. Dr. Awoden further noted that cataracts are more prevalent in those over 50 due to age-related factors, though younger individuals and children can also develop cataracts, often due to underlying eye diseases. He explained that as people age, the eye's lens weaken and degenerate, leading to vision loss if not properly managed.
Throughout the whole world, we have about 2 billion people that have issues with their eyes, and 1 billion out of that, that 1 billion, 90 million are getting it, are blinded by cataract, meaning that about 48% of all cases of blindness is usually related to cataract, and it's been discovered that is common among those people who are 50 years and above. That doesn't mean that it doesn't occur in younger age groups, but those ones that occur in younger age groups, they are usually due to some other things that may be secondary. But the commonest cause of blindness in cataract or from cataract is usually as a result of what we call age relating. As one is getting older, everything is getting weaker, everything is getting, degenerating.
He urged individuals over 50 to undergo regular eye checkups with an ophthalmologist to detect and address potential issues early, thereby preventing blindness in old age. Additionally, he encouraged younger people to prioritize their eye health by visiting an ophthalmologist at least once a year to maintain good vision as they grow older. Dr. Awoden emphasized that proactive eye care can significantly reduce the risk of age-related diseases and blindness, ensuring a better quality of life in later years. An over 100-year-old grandmother in Ogun State has shared her struggles since her daughter Fumilayo Otumba went blind in both eyes due to cataracts. The elderly woman who lives in the one-room apartment with Fumilayo and a great-granddaughter with 3 children revealed how life has become increasingly difficult since her daughter lost her sight. Speaking on My Eye Experience, an IL television program, the grandmother, whose name was withheld for personal reasons, recounted how Fumilayo lost sight in her right eye at birth due to cataracts. Due to ignorance, the family sought traditional remedies using sugar and water as treatment. Fumilayo, despite her deteriorating vision, did not inform her family until she got married. Tragically, in September 2024, her remaining eye also went blind due to cataracts.
Gbọ́dọ̀ ṣeré Awúsá kan pé kó má jẹ́ mú lọ Ìbàdàn kó má fi ṣúgà sí. Awúsá yẹn ìdíye ṣúgà wa ká dẹ̀ lò ó. Tọ́ ṣúgà yẹn kóró yẹn ká fi sómi ká ń kán sí kí kan yẹn jiná kó dẹ̀ rí kiri. Láti ìgbà yẹn kò dẹ̀ sọ́wọ́ pé ojú kan lòún lò. Ṣàwá pé méjèèjì. Eléyìí bẹ̀rẹ̀ ó ṣẹ̀ṣẹ̀ wáyé pé ìkan lòún dédé lọ́ọ̀kan. Kó o dẹ̀ sọ̀rọ̀. Kó jẹ́ ìkan yẹn ká jẹ́ kí mọ wọn má ṣe sí. Eléyìí bẹ̀rẹ̀ ó ṣẹ̀ṣẹ̀ wá jẹ́wọ́. Ó ká mi láburúkú, òun náà rí ń tọ́jú mi, kò sí ẹnìkan. Ó má ra ń kó dẹ̀ lé lọ bí kan. Ọjọ́ orí mi ti ga, ti jìnnà, kó dẹ̀ lè jáde lọ bí kan. Ó ti kọjá 100.
Fumilayo, once a hardworking trader, managed with one eye for years but never sought medical treatment due to poverty. Now bilaterally blind, she can no longer care for her elderly mother, shifting the burden of caregiving to the grandmother. During the program, Funmilayo expressed regret for not seeking medical attention earlier and showed how she has become a burden to her mother and daughter. Her daughter, Temitope, also spoke, explaining how her marriage is on the verge of collapse because she left her husband to move to Abeokuta with her 3 children to take care of Funmilayo. She revealed that her husband has threatened to marry another woman, but she remains committed to supporting her mother and grandmother to prevent them from suffering further. The family is now appealing to philanthropists to assist in restoring Funmilayo's sight, hoping to ease the burden they all face. On the foreign scene, the National Health Service (NHS) in England has approved the accelerated rollout of a groundbreaking treatment called Demendevos for patients with uveal melanoma, a rare and aggressive form of eye cancer. One patient described the approval as the best early Christmas present, offering hope to those who previously had few treatment options. The groundbreaking treatment, marketed at Kimmtrak, leveraged the immune system to target and eliminate cancer cells, providing patients with inoperable uveal melanoma more time with loved ones. Joan Foster, a patient whose cancer has spread to her lungs and kidney, shared how the treatment has stabilized her condition, allowing a precious moment with her family. Developed by UK-based Immunocore, the drug is administered through weekly infusion and is expected to extend survival by approximately 5 months compared to current treatments. Professor Peter Johnson, NHS National Clinical Director for Cancer, speaking to media, highlighted the significance of the approval, noting that this form of melanoma is particularly challenging to treat once it spreads. He emphasized that the availability of this pioneering therapy offers patients the chance to extend their lives and spend valuable extra time with family and friends. Joe Gomes, CEO and founder of Ocular Melanoma UK, celebrated the decision as a monumental milestone, stating that for the first time, eligible patients with this condition will have access to an effective treatment, offering new hope in the fight against rare cancer. A deadly virus outbreak in Rwanda, known as the bleeding eye virus, has claimed 15 lives and infected hundreds, prompting travel alerts in 17 countries. In a post made available by the World Health Organization early this month, the virus, which causes severe internal bleeding and can result in blood seeping from the eyes, is part of the Ebola virus family. Marburg virus is zoonotic, originating from fruit bats and spreading to humans through contact with infused animal fluids such as blood, urine, or saliva. The WHO declared the Marburg virus as epidemic last year due to its alarming fertility rates, which can reach up to 88%. However, early and effective medical intervention can significantly reduce the mortality rate. The virus causes flu-like symptoms including fever, vomiting, and neurological complications, and it can rapidly progress to damage blood vessels, leading to internal and external bleeding. As a highly contagious disease, Marburg poses a serious public health threat similar to Ebola, necessitating heightened vigilance and swift contamination measures. A new eye clinic at Southwest Aboriginal Medical Services (SWAMS) in Banbury, supported by the University of Western Australia (UWA), Edith Cowan University, and the Fred Owens Foundation, aims to transform eye care for Aboriginal communities in West Australian Southwest. The clinic focuses on addressing high rates of preventable eye diseases through culturally safe care and training future healthcare professionals. Associate Professor Kimber Alam from UWA School of Allied Health, in a press release, emphasized the critical need for improved eye health in indigenous communities, where conditions like cataract, diabetic retinopathy, and trachoma are disappropriated, prevalent due to limited healthcare access and cultural barriers. Research shows that over 90% of vision loss in Aboriginal communities is preventable or treated with timely intervention, yet many face undergoing barriers to care. The clinic prioritizes culturally safe care, creating an environment where Aboriginal patients feel respected and empowered in their healthcare decisions. It also serves as a permanent clinical placement site for UWA doctors of optometry students, providing hands-on experience in culturally sensitive eye care. This partnership aims to equip the next generation of healthcare workers to better serve indigenous populations, fostering community-driven healthcare model to close the gap in eye health outcomes. That was the news at 10 on ILTV. I am Angela Luafagumbe. Thank you.
iHealth TV, preventing needless blindness.